Content on the topic pertussis, whooping cough, and pneumococcal disease. Pertussis, whooping cough, signs and symptoms. Early symptoms, stage 1, last for 1 to 2 weeks, runny or stuffed up nose, low-grade fever, less than 100.4 degrees Fahrenheit, mild, occasional cough, apnea. Later symptoms, stage 2, 1 to 2 weeks after the first symptoms start, rapid, violent, and uncontrolled coughing fits. These coughing fits usually last 1 to 6 weeks but can last for up to 10 weeks. Recovery, stage 3, recovery from whooping cough can be slow. The cough becomes milder and less common as you get better. Causes and how it spreads, caused by a type of bacteria called Bordetella pertussis. Bordetella is a gram-negative coccobacillus that adheres to ciliated respiratory epithelial cells, whooping cough bacteria attached to the cilia that line part of the upper respiratory system. The bacteria release toxins, which damage the cilia and cause airways to swell. The bacteria that cause whooping cough spread easily from person to person through the air. When a person who has whooping cough sneezes or coughs, they can release small droplets with the bacteria in them. Diagnosis and treatment. Diagnosis, history of typical signs and symptoms, physical exam, laboratory test of a mucus sample from the back of the throat. Blood test. Treatment, doctors generally treat whooping cough with antibiotics. There are several antibiotics available to treat whooping cough. It's very important to treat whooping cough early, before coughing fits begin. Starting treatment after 3 weeks of illness is unlikely to help even though most people will still have symptoms. By then, your body has gotten rid of the bacteria, but the symptoms are still there due to the damage already done to your body. Complications. Babies and children, 2 in 3, 68%, will have apnea, life-threatening pauses in breathing, 1 in 5, 22%, get pneumonia, lung infection, 1 in 50, 2%, will have convulsions, violent, uncontrolled shaking, 1 in 150, 0.6%, will have encephalopathy, disease of the brain, 1 in 100, 1%, will die. Teens and adults. Teens and adults can also get complications, like pneumonia, from whooping cough. If they have a severe cough, teens and adults can pass out, fracture a rib, lose bladder control, lose weight. Prevention. Vaccines. The best way to prevent whooping cough is to get vaccinated. The DTP shot helps to protect from whooping cough, pertussis, a potentially serious disease, and also protects against diphtheria and tetanus. Dose, 3 doses of 0.5 milliliters for primary immunization inoculated on 3 separate occasions at 4 to 6 week intervals. First dose to be given at approximately 6 weeks of age. 2 booster doses of 0.5 milliliters after 12 months and between the age of 4 to 6 years. Preventive antibiotics. Preventive antibiotics, also known as post-exposure antimicrobial prophylaxis, PEP, are medicines given to someone that has been exposed to a harmful bacteria in order to help prevent them from getting sick. Doctors and local health departments generally determine who should get preventive antibiotics. PEP is given only if they live with the person who has been diagnosed with whooping cough. People who are at increased risk for serious disease, example babies, people with certain medical conditions, or will have close contact with someone who is at increased risk for serious disease, example, women in their 3rd trimester of pregnancy, people who work with or care for high-risk individuals. Streptococcus pneumoniae. Streptococcus pneumoniae bacteria cause pneumococcal disease, but are also commonly found in the respiratory tract of healthy people, especially children. Carriage of pneumococci. Pneumococci are common inhabitants of the respiratory tract. The bacteria may be isolated from the nasopharynx of 5 to 90% of healthy persons, depending on the population and setting. Transmission. Transmission of Streptococcus pneumoniae occurs through direct person-to-person contact via respiratory droplets, autoinoculation in persons carrying the bacteria in their upper respiratory tract. The pneumococcal serotypes most often responsible for causing infection are those most frequently found in carriers. Although carriage does not necessarily lead to disease, it is an important precursor for pneumococcal disease. Researchers do not clearly understand the immunologic mechanism that allows disease to occur in a carrier. However, disease most often occurs when a predisposing condition exists, particularly pulmonary disease. Pneumococcal infections are more common during the winter and in early spring when respiratory diseases are more prevalent. Pneumococcal disease, clinical features. The more serious clinical syndromes of pneumococcal disease are pneumonia, bacteremia, and meningitis. Less serious, but more common syndromes, include acute otitis media and sinusitis. Pneumonia. Pneumococcal pneumonia is the most common clinical presentation of pneumococcal disease among adults. The incubation period of pneumococcal pneumonia is short, about 1 to 3 days. Symptoms generally include an abrupt onset of fever and chills. Pleuritic chest pain, sharp chest pain that worsens during breathing, cough productive of mucopurulent, containing both mucus and pus, rusty sputum, dyspnea, feeling short of breath, tachypnea or tachycardia. Tachycardia was defined as greater than or equal to 100 beats per minute, tachypnea as greater than 20 breaths per minute at presentation. Hypoxia. Hypoxia is a state in which oxygen is not available in sufficient amounts at the tissue level to maintain adequate homeostasis, malaise, or weakness. Bacteremia. Bacteremia without a known site of infection is the most common invasive clinical presentation of pneumococcal infection among children 2 years old or younger. It may present as fever greater than or equal to 39 degrees Celsius in otherwise well-appearing children. Clinical features of bacteremia with focus depend on the primary site of infection. The overall case fatality rate for bacteremia is about 20% but may be as high as 60% among patients who are older adults. Meningitis. Symptoms may include headache, vomiting, fever, lethargy, the feeling of being very tired and not having any energy, nuchal rigidity, neck stiffness caused by bacterial meningitis, seizures, coma. The case fatality rate of pneumococcal meningitis is about 8% among children and 22% among adults. Neurologic sequelae, such as intellectual and behavioral disabilities, seizures, hearing loss, and motor deficits, can happen in as many as 50% of pneumococcal meningitis survivors. Acute otitis media. Acute otitis media, AOM, is defined as an infection of the middle ear. In young children, ear pain may be shown as irritability, change in sleeping or eating habits, or holding or tugging at the ear. Fever, ear drainage, and hearing loss may be present. Sinusitis. Acute bacterial sinusitis is often triggered by obstruction of orifices by viral infection, pollutants, or allergens in the atmosphere. Bacterial sinusitis tends to have longer duration of symptoms, and more severe clinical manifestations, purulent discharge, pain compared to viral sinusitis. Pneumococcal disease, diagnosis, urinary antigen test. The pneumococcal urine antigen test, UAT, is an assay commonly used to identify pneumococcal antigens excreted into the urine. A commercially available urinary antigen test can detect the C. polysaccharide antigen of Streptococcus pneumoniae. Prevention. Vaccines are the best way to help prevent pneumococcal disease. Chemoprophylaxis is not recommended generally. The pneumococcal conjugate vaccine, PCV13, and the pneumococcal polysaccharide vaccine, PPSV23, protect against pneumococcal infections. PCV13 protects against 13 types of pneumococcal bacteria, which cause the most common pneumococcal infections in kids. PPSV23 protects against 23 types. PCV13 immunizations are given to all infants as a series of 4 injections, the first at 2 months of age, then at 4 months, 6 months, and 12 to 15 months. PPSV23 immunizations are recommended as added protection against pneumococcal disease in kids 2 to 18 years old who have certain chronic health conditions, including heart, lung, or liver disease. Thank you.